Hi, my name is Lauren Scott and I'm with the University of Manitoba as a nursing student. Today I'm going to be demonstrating how to administer insulin IV continuous, and then as well as chest tube dressing change. So first I'm going to start off with some hand hygiene before entering the patient's room, and then I'm going to knock and then enter, introduce myself. So this is Bryson, Scotland. So hi Bryson, I'm going to be here today to administer your insulin and change your chest tube dressing. So I'm going to get him to state his name and FIN number. So Bryson, can you say your name for me? Good. And your FIN number? Good, thank you. And any allergies? No? Okay, thank you. So you've had insulin before, this isn't new. It's to keep your blood glucose within the doctor's ordered range here. He's not in any immediate distress. I'm going to move his bed up to semi-Fowler's. And the bed is in the lowest position, and the side rails would be up. For demo purposes, I'm going to keep them down so I can work on him here. So we're going to start off with the insulin administration. So I'm going to start off with my first check. So I've already checked the patient's identity as part of my safety check, just to confirm that he is who his response says he is, but I will check it again to my MAR here. So could you, state your name for me again? Bryson, Scotland, and your FIN number please. 1, 2, 3, 4, 5, 6, 7, 8, 9. So that is right, and then no allergies. So we've done the first patient right, right patient. So now we're going to do right drug, right dose, right route, and right time. So right here, I'm just going to check in the monograph that this medication was prepared correctly. I had 2 nurses sign and prepare this for me already. So I'm just going to confirm that everything is correct. So here we have right patient, Bryson, Scotland, and we have right drug, insulin, Humulin R, continuous infusion, right dose. So we have 2 units per hour, continuous. Right route is IV, and right time is now. And then I'm going to look at my monograph here. So it's for insulin, Humulin R. So it can be given by a student nurse. The nurses that prepared this also checked that the insulin was not expired. So for IV continuous here, 1 to 10 units hourly. So he was within the safe range at 2 units per hour. So here we are going to use the colleague Guardian pump, and we are going to do 100 units for the dose. Volume is 1 ml, and 100 ml normal saline mini bag for a final volume of 101 mLs and a final concentration of 0.99 units per ml. So this completes my first check here with the monograph. Then I'm just going to check with the MAR now. So I've done right patient, Bryson, Scotland. Okay, and we've done this one already, so that's the end of the first check. So I'm going to hang this up here now. I'm just going to check that the correct tubing was used with no ports, and it is. The other nurses have primed the line, so there's no bubbles here, and the line is labeled with insulin. We have normal saline, which is compatible, running as a carrier TKO to the patient as well. And the Y site here has already been primed. It's attached. I've looked at the IV site here. It looks good. It's patent. We've flushed it and assessed it already. So now I'm going to put this into the pump here. Sorry, Bryson, I'm just going to put the tubing on your arm there. So we're going to go to the primary here. We're going to go into colleague Guardian and look for insulin. Right here, so insulin, we're going to select that. So my line is labeled. So we have the drug amount is 100 units and 101 mLs. The concentration is 0.99 units per ml. we have the rate we want to do is 2 units per hour, so 2 mLs per hour. And that is good. So then we're going to confirm the primary. And now we're going to do the second check. So we have right patient, price in Scotland, price in Scotland. We have right drug, insulin, Untitled R. Right dose is 100 units at 2 units per hour. We have right route is IV and right time, the time is now. So that completes my second check. I will now get a second nurse to come independently do the second check. So they've confirmed that everything I have into the pump is correct. So once again, I'm just going to do my third check before hitting start. So I have right patient, Bryson Scotland, right drug, insulin, Untitled R, right dose 100 units per ml at 2 mLs per hour, right route IV, right time, time is now. It's been signed and dated by 2 nurses. We've completed 3 checks. We have the right tubing, everything is primed. So now I'm going to hook it up before hitting start. So I have here some alcohol swabs. So I've done hand hygiene. I'm going to just put on gloves just in case. And then we are going to get this ready. So I have followed this line and know that it goes to my TKO of normal saline. And this is the line I'm going to be hooking up to the other port here. So I want to alcohol swab this for 30 seconds. Let it dry for 15. And then I will be taking this off here, so not to contaminate either end, and then connecting them. Okay, so now I'm gonna open this line here, make sure this is open, and then I've confirmed with 3 checks. So now I'm going to hit start. So I see that my insulin is running, my line is labeled, it's running at the correct rate, correct dose, and I'm going to wait for 3 drips just to confirm that it is running correctly. So I've seen my 3 drips. Before I started this, the patient had the right to refuse. He was educated on why he's getting the insulin, is to keep his blood sugars within the blood glucose goals of 6 to 10. He consented to that. So I'm just going to let him know, Bryson, if you start to feel any symptoms of hypoglycemia, dizzy, sweaty, shaky, any of that, just hit your call bell, let us know. I'll also be monitoring him as I'm staying here to do his chest tube dressing change with him. So that completes the insulin administration. Now we're going to move on to the chest tube. So I'm going to take off my gloves here. I've reviewed that there is a doctor's order to change the dress tube every 3 to 4 days, and today is the 3rd day, so we're going to change it for him. The patient has had this before. He declined any analgesics. He says it's not too painful, and he's been educated on what we're going to do. He's consented. He says it's good. So thank you, Bryson. Just going to confirm again. Patient hasn't changed. We haven't left the room, so correct patient. So we can start this now. I will do my initial safety check regarding the tube. So I've already checked him when I entered the room that he's not in any distress. He's in the semi-flowers position. Side rails would be up. I've checked over here that the suction is on and set to low suction. It's in the green, so that's good. So then I want to follow the tubing all the way to the other side here. Making sure nothing's kinked or plugged, everything's connected properly. Good, so I follow it here to my Plurivac. So with this, I'm going to check that the orange ball is visible, and it is. I'm going to check that the dry suction is set to 20 centimeters of H2O. I'm going to check here for any bubbling. If there was, that would indicate an air leak somewhere in the line, so I would use my emergency forceps there that I've checked that I have 2 of to clamp the line and look for that leak. I'm going to look here to see any titling. There should be, with his inhalation and expiration, some titling here, and I'll check the drainage to make sure there's nothing abnormal or excessive. There's just regular serosing drainage, minimal amount. I would mark that at the start of my shift, so everything looks good there. So then now I'm going to follow the rest of the line up to my patient, make sure there's no kinks, nothing is plugged. So Bryce, I'm just gonna get you to lift your arm here, please. Get that out of the way, good. And I'm just gonna keep him covered as much as I can. Expose the site, thank you. Okay, so we followed the line to him, nothing is kinked. The pleurovac is below the drainage site, so everything can drain smoothly, so that's good. So Bryson, I'm just gonna get my supplies ready here now to start your dressing change. So I've done hand hygiene again, and I have my dressing tray here. Before, make sure I have everything that I need. Okay, so I'm going to begin to open my tray here. Okay, I'm grab my forceps. Okay, and then I know that my 1-inch border is here, so I'm going to remain aware of that. I'm just going to take this out because I know I don't need that. I also don't need this garbage bag here. I'll get my other forceps out. Ready. Okay, oops. Make sure those don't touch my hand. Okay. Good, so those are ready. I'm going to add some normal saline to the tray. Be careful not to splash on anything. And I will add my drain sponges here. So I know that I'm going to need 2 drain sponges here. And then I have a 4x4 in there to include the dressing after. I'm going to add my jello net. Then I have my Me-Fix here for later. And I have my sterile gloves. Okay, so I'm going to do hand hygiene again. Okay, Bryson, I'm going to take off your old dressing now. So for this, I want to make sure that I'm stabilizing the tube to make sure I don't pull it out when I'm taking off the dressing.
And we also got the doctor's order for dressing change.
And I want to make sure I'm doing this as gently as possible so that I don't pull out his tube by accident. Okay, so I have his old dressing here. I'm going to assess it for any drainage. And before I took off the dressing, I would have felt around for any subcutaneous emphysema, any crackling, anything like that. And there was none with him. So yeah, to assess the dressing here, there's minimal amount of drainage. Everything looks good. I'll write that in my documentation after. And I would make sure that all this stuff is off of the tube. But since this is demo, it's been used. It's very stuck on there. So I would take my forceps here to remove this old jello net while still stabilizing the tube. And I would discard of both of those. Okay, so take off these old gloves here. Now I can assess the site around the tube. Everything looks healthy and healing well. There's no redness, swelling, anything abnormal. So I would do hand hygiene again, and I would put on another set of clean gloves. And so I would now use my forceps here. I'm just going to move the gelonette out of the way for now and the drain sponges, but make sure they don't contaminate in my 1-inch border here. So I'm going to do some rosettes here, a little bit of normal saline, drain it out 1 swipe per wipe. So I'm going to start at the site here, around, discard that. Okay, again, go a little further out, 1 swipe per wipe, around, that, and then I will want to do a little bit on the tube, that wet, rinse it out. So I'm going to do the top of the tube here, and then I'm going to do the bottom of the tube under here. Good, so I'd want to clean around the skin around the whole part that'll be occluded by the dressing, which I have, so now it's time to dry. So I'll take another dry rosette here. Oops. And start by going, again, closest to the site, 1 swipe per wipe around. Gauze wants to be stubborn today, so it's sticking all together. Okay, another a little bit further around. And I would keep going around on the skin until everything is cleaned and dried. I'm going to go down the tube here once. And then again underneath the tube here. Good. Okay. So now it's time to do the gelonette to occlude. So I'm going to take off those clean gloves. I'm going to put on some sterile gloves here. Just on the edge of my tray. Start with my dominant hand here. Good. Okay, so now my hands are sterile, so I can touch in my sterile fields here. So I'm going to take off that. So I'm going to make sort of a little twist here with this. I'm going to start, make sure not to touch anything unsterile here. So I cleaned around everything. So wrap that around. Make sure it's occlusive. So that looks good. So now I'm going to get rid of the fact that my hands are sterile because they are no longer sterile. So I'm going to go back to my forceps here for the drain sponges. Just going to move this garbage out of the way. I'm going to take one drain sponge here, and my hand touched there on my sterile tray, so my hands aren't sterile anyway anymore, but I know that this part of my sterile field is also no longer sterile, so I'm going to make sure not to touch anything I want to keep sterile in that area. So I'm going to take my drain sponge here and put it around like that. I'm going to take my second one here and put it an opposite direction here. Good. I'm going to take this sterile 4x4. Okay. And just place that on top. Okay. So now we no longer have to be sterile. That's all occluded. So I'm going to take my knee fix here. And I want to write the date and time. So today's date is November 8th, and it is 1100. I'm going to sign with my designation on here. So I'm going to start by doing top, the top part of the dressing here. So this part is no longer sterile because I've touched it. So I'm going to discard of that one, and I'm going to get a second one here because we want to maintain everything under the dressing sterile. So I'm going to pull that apart again, keeping this sterile here. I'm just going to touch this gown, so that would again not be sterile, so I would get a new one, but for demo purposes, we're just going to keep going with this one for time. So I want to make sure this is all occlusive and tight, good. And then the one here that I have designated with my signature date time, it's going to go, fold it back. So again, I wouldn't want to use this one, I'd want to get a new one because we want to make sure that the dressing underneath is sterile, but for demo purposes, we're still going to use this one here. So we want to make sure this is occlusive again, and then pull this off here. And then around the tube here, we want to do tenting so that if he pulls on the drain, it pulls on this and not pulling the drain out. So we tent that there. Everything is occluded, sealed, good. Okay, so I would cover him back up. I'd clean up all these supplies, put his arm back down, keep him in semi-fowlers because that's where he's comfortable, lower the bed as low as it goes, lift the side rails. Bryson, how did you tolerate that? Was it okay? Yes, he says it was good. So I would document about the insulin administration. I would sign the MAR, which I'm going to do right now. So I sign the MAR here, my date, time, and designation. Good. I would document in the IPN that we changed his dressing, that he had no distress, he tolerated it well. I would document what we used to change, what I found on the old dressing, the type of drainage we had in the Pleurovac here, an amount, and yeah, then I would say thank you, Bryson, for letting me do this demo on you today.